And then other things that we all know of but sometimes struggle with: smoking cessation. So not smoking at all is the aim, really, because we know that smoking will challenge your diabetic control and again add on to your risk of developing type 2 diabetes, and can also worsen some of the complications that you can get with regards to neuropathy and vascular, so nerve and blood vessel bad health in diabetes. We all know we should have a balanced diet. So I have just heard, just before jumping on this webinar, about Dr. St. John's book, which I've hyperlinked in my resources. But I feel very strongly about diet because in my experience, personally and professionally, Afro-Caribbean diets have been demonized as unhealthy. And I disagree. I think it's about how you cook and what you cook. So I'm so happy, and I'm going to buy your book after this.
And how much you eat. That's the third part.
Yes, I'm going to. And can you tell us, I know, just briefly about your book, because I think this is a very important thing to share.
So for those of you who don't know it, I'm a co-author of a book which gave the information about the carbohydrate content of traditional foods eaten by the African communities, and I apologize for that generic term, African Caribbean communities, as well as South Asian and Arabic communities as well, so that people living with diabetes or at risk of diabetes would be better informed about that carbohydrate content and can make informed decisions about what might be healthy for them, be it portion size or be it the type of traditional carbohydrate food that they might want to eat. That's it in a nutshell.
Thank you. And I've included the link in the resources at the end, so definitely check it out. So of course, balanced diet, minimizing our alcohol intake, moderation really is the key when it comes to these things, isn't it? And all of these hopefully will feed into controlling our blood sugar levels, our cholesterol levels, and blood pressure if you're impacted by that. And a key thing, not the last thing, but the foundation really of a lot of this is our stress and emotional management. This is very, very important because, we are all living, there is always some kind of stress or the other. And in many ways, chronic conditions are a form of stress in our body in terms of inflammatory stress. So we really need to be mindful of, taking control of that and engaging with treatment options, therapy options, practices, exercise, meditation, prayer, whatever it is for you to help manage that stress. This is, again, feeding back into weight loss, stroke, exercising. Wonderful resource on YouTube. This is a family, so I forget her name, but that's the mom in the middle and her two daughters. It's amazing.
Wow, what an advert. That's mom in the middle.
That's mom in the middle.
That is amazing.
Mom
right,
is,
okay, I'm going to have to check that out.
You have to check out. Mom is 67, and her and her two daughters basically have this award-winning YouTube channel, and it's called Kukua African Dance. And they basically have, it ranges from 10 minutes. This one's a 15-minute workout. They have 45 minutes, and you just place it on and just dance along to them. It boosts your spirits. It gets your heart rate going. You can go at your pace. You don't have to go too hard or whatever suits you. And I just think getting your body moving whilst enjoying, soul uplifting music is a wonderful way to, again, keep fit and healthy when it comes to diabetes. Okay. And then I guess specifically in terms of some of the medical management options. So I'm focusing, this is quite a busy slide, okay? Focusing specifically on genito-urinary health. So when it comes to good sexual health, my definition of good sexual health is safe sex and consensual sex, obviously. So using condoms to protect you from any sexually transmitted infections is absolute key. There is also a big element around personal hygiene. And we have a lot of, again, these are myths I probably didn't include in that slide around how we keep ourselves clean. So it's very important to recognize the difference in anatomy. So the vulva or labia are the skin outside the vagina, and the vagina is on the inside. So the vagina is an organ that essentially is a self-cleaning organ, essentially. And it is, the pH balance is such that using any kind of aggressive or scented soaps inside the vagina can actually predispose you to vaginal dryness and thrush and just general discomfort. So it's important in however you wash to focus on washing your vulva, not your vagina. You don't want to put soap or anything inside because that is very disruptive. And some people who already have conditions, so these neuropathic conditions that make them more prone to vulval dryness or discomfort or pain, may benefit from using a soap substitute. So one I often prescribe is dermal. And actually some of us in hospitals, because we're always washing our hands, alcohol gel, our skin gets very sensitive. And using, normal soap is very dry. And so many of us will use this thing called dermal, which is a very effective soap substitute. So that can be something, somebody who's impacted by vaginal dryness and discomfort can switch to. Very important as part of personal hygiene. After going to the toilet to pee or to move your bowels, to wipe from the front to the back. So as women in general, we are more prone to urinary tract infections because the tube we pee from, the urethra, is quite short. And also the opening of the urethra is very close to the anus, which is the back passage, where obviously you have bacteria that comes from the gut. So essentially, it doesn't take very much for us to get urine infections, particularly after engaging in intercourse. So it's very important to, again, wipe from the front to the back so you're not introducing any bacteria from the back passage into the urethra. And this is the same ideology behind peeing after vaginal sex. Because again, if, for example, with the friction of intercourse, there's been some bacteria that goes up the urethra or close to the urethra, peeing can flush all that away. I'm a big believer in cotton underwear. Some people talk about bamboo underwear as well, but essentially you want kind of natural fibers because, again, if you are more prone to vaginal dryness and discomfort, you will find this more soothing. Another very important thing that is useful is the use of vaginal lubricants during intercourse, but even just in general, if you are not sexually active, you can use vaginal lubricants. Replens is a very good, well-known moisturizer, which people can use a couple days a week, and that can improve the kind of cystitis, discomfort, uncomfortable sensation people get. With regards to urinary incontinence, bladder retraining and pelvic floor exercises, that again is something that some people may find very helpful. And then finally, HRT, also known as hormone replacement treatment. This is in the context of people who are perimenopausal or postmenopausal. HRT is a hormonal way of replacing hormones which can improve your genito-urinary health. Because as we get older, naturally what happens is the estrogen levels fall a bit, and that can manifest as kind of the vaginal dryness and the skin tightness. And so HRT can improve that. HRT is safe, but you have to have a discussion with your provider about your personal and individual health risks.
Can I just also say that you can use the HRT topically? So you can use the vaginal creams, which can help with that dryness and vaginal health as you get older. And the other thing I just wanted to also highlight is don't be frightened if you're having problems with urinary incontinence to go to your primary care physician, so your GP, because they can refer you for pelvic floor exercises done with a physiotherapist if you're not able to do that successfully yourself at home.
Mm-hmm. Absolutely. And then another kind of, I guess, group of treatments, antidepressants can be useful in managing some of these symptoms. It is important, again, to recognize that some of these antidepressants can also lower your sex drive. So it's a balance, again, of the benefits and risks for you as an individual. I will frequently refer people to our psychosexual experts, and these are specialists who basically use a combination of methodologies founded and foundational on essentially counseling and therapy to address manifestations of sexual dysfunction, essentially. So again, this is something that you can ask for referral to. I know currently the waiting time is quite long, but it's again a service that's available in several areas. In some of our clinics as well, particularly our urogynecological clinics, with women who are impacted by some of these genitourinary conditions, we will routinely, prior to referring them to psychosexual therapists, talk them through the use of vaginal dilators. Now, these are little devices. They come in various sizes, and essentially they are a way of, under your self-guidance, basically, and with lubrication, basically using small devices that can help you retrain your brain and the vulva with regards to some of the discomfort you're feeling. It's also useful in some of our clinics to talk about masturbation, because again, that is a controlled way in a safe space for you out with somebody else with lubricants, HRT, or whatever you need to try things in such a way that when you then go to engage in intercourse with your partner, you might find it, I guess, easier because you've done stuff by yourself. And then I've also put a link there around the use of laser therapy, which can be used for hair removal, as well as in addressing some of the hyperpigmentation we see. But the key, though, is really good blood sugar control, particularly when you have all of these various manifestations. You can try and treat the symptom, but if your underlying blood sugar control is not good, then really you will only be scratching the surface, really. So the key for all management is to make sure you're on top of your blood sugar control.
And as you said, I think with the previous slide, that emotional and psychological health underpins everything. In primary care, we would tend to also refer for what we call talking therapies as well. So similar to the psychosexual therapy, but this may be obviously looking at it in a holistic viewpoint, just dealing with the issues that may be preventing you from having your full sexual health.
Yeah. And then again, something that I think is applicable to every aspect of life, including, I don't know, let's say you want to go and you're looking for a new car or a new mortgage or whatever. This mnemonic brain is so important. And when I wrote this on the slide, I laughed to myself because growing up in Nigeria, my mom would always, there's this saying, use your number 6, which means use your common sense, or use your as it's usually said in a dismissive way when you're not being sensible. But anyway, that was what I thought of. So basically, when you are seeking care or advice from somebody who is a specialist or provider, use your brain, okay? And I've said 4, but actually, is it 5? It's 5 questions. And these questions, so B for benefits, R for risks, A for alternatives, I for intuition, and N for nothing. So what are the benefits of using the soap substitute? What are the risks? What are my alternatives? And then you need to ask yourself, okay, this specialist has told me XYZ. What am I feeling? What's my intuition? What's my gut feeling? And then finally, you should ask them, what would happen if I did nothing? And again, this is the foundation of providing this kind of shared decision-making platform where you ideally should be empowered to be making these decisions and certainly seeking this from your providers. And then the last thing to talk about in terms of management is intimacy. And I think it's important because when it comes to sexual health, you don't have to have sex to have good sexual health. Intimacy is a very important part of good sexual health. And if you are in a consensual relationship where there is no coercion, where there's consent and communication, this is absolutely great sexual health. And there are other things that you can engage with other than, penetrative sex. There's massages, there's date nights, there's cuddling. You can get creative. You don't have to have intercourse to have good sexual health. And we maybe need to think a bit more about intimacy, which really focuses again on your physical, emotional well-being in addition to sex. This is a very important part of good sexual health, finally.
Wonderful. My goodness, that is absolutely amazing. Dr. Isioma, can't thank you enough for outlining all the different aspects and taking us through that journey from the myths to feeling empowered, knowing that there are so many things that we can do to improve our sexual health and in the context of our general health and well-being. So once again, thank you so much.
Thank you very much for having me. And this last slide here is just a list of some useful resources. And in particular, what I highlighted earlier is Dr. St. John's book, which, highlights focusing on basically, I guess, culturally appropriate dieting and food in our communities. So thank you very much for having me. And yeah, go forth and have good sexual health.
Thank you so much.